and a local mom is waking up thankful she was able to celebrate another Mother's Day weekend with her 2 kids.
She's a survivor of heart disease, trusting her own instinct after her son's birth to go get checked. KXAN's Blake Devine joins us live in studio here with her story. Good morning, Blake.
Good morning, Tom and Sally. Just a few weeks after giving birth to her son, Millie Lee started feeling pressure in her chest and difficulty breathing, but as it turns out, she had a heart condition that, left untreated, could lead to a heart failure.
Is this a pink flower? I would just find it really hard to go back to sleep, and when I tried to lie down, I would just have a lot of pressure in my chest where it felt hard to breathe.
Only 10 weeks after her son was born, Round Rock resident Millie Lee was diagnosed with mitral valve prolapse, a disease affecting the valve between the heart's chambers.
We were very surprised. It's a diagnosis that, typically you hear about happening in older people. Do you want to sit down?
The 36-year-old was also diagnosed with severe mitral regurgitation.
So that's a condition where the mitral valve leaks, and that blood can back up onto the lungs and make it difficult for a person to breathe.
This led to Lee having a life-saving surgery.
And there's always a lot of evidence before you start a clinical trial.
As she was operated on by cardiothoracic surgeon Faraz Kerendi. The doctor described the procedure as minimally invasive as he worked through tiny 2-inch incisions.
With this minimally invasive technique, we go through a small incision in between the ribs, sometimes with the aid of a camera, which allows us to do the valve surgeries through a much less invasive approach.
Just 2 weeks after surgery, the mother of 2 was able to bounce back, returning to her everyday duties.
I was able to pick up the baby again and start driving, so I was able to be off pain meds by about a week out.
Originally believing her heart pain to be postpartum symptoms, Lee learned a valuable lesson.
Listen to your body and take yourself seriously. If you feel like something's wrong, it probably is. Oh, you went down for Arthur? Okay, 1, 2.
Dr. Kerendi says the successful surgery will last at least 15 years, while Lee is just grateful to be able to celebrate Mother's Day and to have caught the condition so quickly. And she hopes to inspire others, she hopes to inspire mothers and other people to check their heart health, because you never know.
It would be really easy, like you mentioned, just sort of overlook it as a symptom of, I just had a child, my body feels off.
Oh yeah, your body's changing.
Yeah. But thinking, well, I have this heart condition, go get it checked.
Exactly.
It's so crazy that she had that surgery, and you see in that video, babies want to play. It's like
she's
she
not
just
sitting in bed recovering.
Went through this, and it's like, no, okay, cool, mom, but toys, right? Mom, superheroes.